Honorable Minister of Health, Guyana, Dr. Frank C.S. Anthony, our President and Founder, Mr. Saju Bhaskar, Vice President, Mrs. Chitra Lakshmi, Dr. Util Richmond Thomas, Director, Mental Health Unit, Ministry of Public Health, Guyana, other esteemed guests, our esteemed speakers for the conference, our students, my colleagues, and dear friends. It gives me immense pleasure in welcoming you all to the third international conference for Texila American University. Our previous international conference, as you're aware of, was on non-communicable disease. The focus was on heart disease, diabetes, and cancer. Continuing the same, our current conference, the focus is going to be another two non-communicable diseases, mental health and road traffic accidents, two major public health problems. Mental health, also known as the silent non-communicable disease, has always been a major public health issue, not only for Guyana, but for the entire region. According to the reports, in Guyana, neuropsychiatric disorder contribute more than to the burden of disease than tuberculosis, HIV, and malaria combined. Unipolar depression has been identified as the fifth greatest contributor to disease load in Guyana. Suicide has been long identified as a major problem in Guyana. Guyana consistently ranked among the top 5 countries in the world with highest suicide rates, not a data that we are proud of. Currently, we are ranking 3rd among all countries in the world, behind only Lithuania and Russia in suicide rates. Suicide rates in Guyana has been reported as 44.2 per 100,000 population, comparing with our neighbors Suriname 27.8, Venezuela 2.6. So you can imagine how big a problem it is here. All these data are from the pre-pandemic times. The current COVID-19 pandemic has made the mental health situation even worse. The mental health problem, which was earlier limited to specific population groups, have now made inroads in all population groups, young and old, all economic sections, including our frontline health workers. Our frontline health workers are fighting two things. They are not only fighting COVID-19 pandemic, but they are also fighting their own problems with mental health, which makes the situation even worse. Mental health problems are much more complex than it seems. Lack of proper mental health services, lack of mental health personnel makes it harder to identify and treat such individuals. Moreover, the social stigma attached to it results in severe underreporting of this condition, which means that the problem might be much larger than what is being perceived by us through data and other things. Mental health is linked with other diseases as well. Historically, in non-communicable diseases such as cancers and chronic diseases, but now with COVID-19, mental health has been linked to this current pandemic as well. During the 2 days of this conference, we hope to not only identify the major mental health problems in Guyana and the region, but also expect to identify various factors contributing to it, and more importantly, specific and concrete solution to the problem. With the help of our local and international experts on the subject, which are going to talk to us during these 2 days of conference, I am confident that we will be able to suggest amicable and practical solutions to the problem. This conference, which is going to happen over 2 days, has been divided into 3 scientific sessions. The session that we are currently having is the plenary session. Afternoon today, we'll have a session on mental health in general. Tomorrow, the first session is going to be mental health in COVID-19 perspective. We thought it needs its own session because it's such a big deal. And the final session tomorrow afternoon is going to be on road traffic accident. Road traffic accident, another major public health issue in Guyana. According to WHO, deaths from road traffic accident in Guyana is among the top 10 causes of death. Maximum deaths due to road traffic accident happens in the age group 5 to 14 years old, which is a big loss to the nation. A larger number of road traffic accidents leave the victims as disabled for the life. And these people are the ones who are at risk of suffering from mental health conditions also. We have a panel of experts who are going to present and discuss various factors contributing to road traffic accident and would explore possible solutions to this major hazard to the health of people of Guyana. I'm really looking forward to some meaningful discussions to learn a great deal about these major health issues and expecting to come up with some practical and concrete solutions. I'm sure you all are having the same thoughts. So let me welcome you all once again to the 3rd International Conference of Texila American University with the focus on mental health and road traffic accident. I'm hoping you all will have a lot of information and take home messages over these 2 days of discussion and presentation. Thank you all very much.